Kent Brown?
Yes, sir.
Yes, sir.
By way of introduction, I am Kent Masterson Brown. I am from Lexington, Kentucky. I have practiced law in Lexington and in Washington, D.C. as counsel for Webster Chamberlain Bean for, well, nigh 20 years with them and 40 years of law practice. And I'm a graduate of the School of Law at Washington and Lee University in Lexington, Virginia. The emphasis of my law practice has always been on the litigation of matters affecting health care. Most of them are issues arising out of government involvement and regulation in the healthcare industry. And most of the cases I have been brought in the United States courts in Washington, D.C., but I have also litigated in every circuit in the United States, save one, all on issues relating to health care. I honestly am so impressed by Dr. Williams. I really don't even need to get into my discussion of the constitutionality of the bill before us. I leave it to an economics professor to do that. Rather, what I'd like to do is discuss Obamacare itself. For the past 7 months, I have been in an examination of Obamacare, the entire statute, all 2,700 pages, and all the regulations that have been promulgated pursuant to that statute, which now reach 20,000 pages. I was told by my secretary when I left last week that shortly after I left, I had a stack of nearly 2,000 pages of them sitting on my desk that had been promulgated after I had departed. So you can see the profusion of regulatory activity with respect to this one bill. And beyond looking at the regulations in the statute, I have also tried to track all the reports of the General Accounting Office and all the reports of the Congressional Budget Office, as well as tracking the news stories with respect to each major item that is coming online with respect to Obamacare. And I'm here to tell you, quite frankly, that this nation is about to be plunged into absolute chaos with respect to the availability of health insurance and the availability of health care. And the reason for it is extraordinarily simple. They've taken away from the insurance industry the ability to actually insure. And they have turned it into a system where they absolutely just underwrite everything, irrespective of who it is, where they come from, what their conditions are. They simply pay, they subsidize everything. And that's bankruptcy for any and all insurance companies. And let me just go through some points that underscore it. I have since October. I began my examination of this in the summer. In October, I began to write and to speak and discuss that the insurance premiums for all of us in this country are going to rise between 200% and 300%. Now, we've already seen evidence of it. The General Accounting Office and the Congressional Budget Office just recently, Monday a week ago, came out with a report that for those people below 30 years of age, their insurance premiums, they can expect to rise 186%. Now, these are the most insurable people in the world. They're young, they're athletic, they're vigorous, and their rates are going up 186% according to the Congressional Budget Office. Now, what is it for the rest of us? You can just imagine what it is going to be for the rest of us. The Internal Revenue Service, who is also active writing the regulations under Obamacare, has used in its most recent regulations the example of the bronze level plan which is the lowest plan offered by Obamacare, it carries only a 60% payment rate for the carrier. The 40% is to be picked up probably by you of every health care service. That low-level plan, the IRS is expecting to cost a family $20,000 a month in 2016. Now that is flat out unaffordable. What are those people going to do? We have no idea. Absolutely no idea. And why is it happening? Well, it's easy to figure out. Obamacare calls for community rating, which means no one's rated at all. Just everybody's the same. I get the policy the same as an IV drug user or an alcoholic. Same policy, costing the same amount of money. And why? Because what the community rating, they're reducing everybody to the lowest common denominator and ascribing the premium to that in order to make this work.
Mr. Brown?
Yes.
You have a question?
Yes.
Representative Delaney?
Yes.
Mr. Brown, most of the people on this committee are opposed to Obamacare. Most of the people on this committee want to resist Obamacare. And there are two bills on this agenda today to resist Obamacare. One is 3101. Of course, we have talked about a compromise amendment. We talked about a compromise amendment with Mr. Quinn and Mr. Pope proposed. And the reason I'm asking this, I don't want to run out of time before we get to the important stuff.
Right.
But we have 3101, which proposes to arrest judges and federal officials and that sort of thing. And then we have 3473, which proposes to resist. And I would like for you, if at some point in your remarks, if you could comment on those two. You go ahead and finish with what you were saying, but if you could, that's very important for us. If you could comment on the two of those and the proposed amendment.
Let me wrap up here in just 2 minutes, and then I'll answer your questions directly. Beyond the raising of rates, there's been a lot of talk about all these, what Sarah Palin has said, death panels. I have found 11 of them, and believe me, folks, these are in fact that. You're required to buy minimum essential coverage. That includes preventive care services. Among the preventive care services, the Department of Health and Human Services has stated that they shall include contraception, abortion, and sterilization services. And as a result of that, and by the way, they're to be provided without copays, because of the massive amount of increase in cost to the carrier of just providing that, the Preventive Services Task Force has stated now that it's going to have to reduce other services. Those include mammograms for women between 40 and 49, no coverage for CT colonography for colorectal cancer, no cervical cancer screening for women over 65, no breast cancer screening using digital mammography, no screening for ovarian cancer and genes that give the risk of rise the risk of breast cancer, no clinical breast exams for women, and no training by physicians of women to do their own clinical breast exams. And it just illustrates how horrific this statute is, this bill is, and why it is important for the state of South Carolina to stand up and say it is not to be enforced, at least in this state, by people from this state. Now, with respect to your question, sir, we have discussed the two bills and the Quinn-Pope amendment. I am in favor of the Quinn-Pope amendment. I do think it reserves the right for the state at a future date to do what it sees fit, whatever that is, based upon how this bill unfolds. The original bill as proposed with the penalties, I think were problematic. And I so stated to Mr. Chumley and to others. And rather than do that at this stage, South Carolina should reserve the right to do what it deems appropriate, but go on record stating that this state opposes Obamacare and will do what is necessary, which I think the amendment to 3101 does.
Thank you, sir.
Yes, sir.
Representative Quinn.
Thank you, Mr. Brown, and just for everybody here, I know that we were here early this morning, and I've been talking with Representative Chumley about my support of his bill and wanting to move forward in a way that we could best oppose Obamacare. And I appreciate your and Mr. Chumley working with us on this amendment this morning. One of the things that I think is important, and you and I discussed earlier today, was one of the things we can do, so for is not only limiting state employees in terms of how they try to, or preventing them from trying to enforce aspects of this, but also, for example, the forced home inspections that I've heard about, but also.
And those are true, by the way.
Yes, and one of the other concerns I have is, we have a pretty activist local government, and it seems to me a lot of some of the more liberal elements of South Carolina public officials that tend to run for school board and county council and town council. And and one of my concerns also is how local government could perhaps run the state government unless we take affirmative action here today with this bill, meaning a school board, town council, or county council could come out and form their own exchange. Would you mind, because just so you know, one of the reasons why Mr. Delaney was trying to get to the heart of this matter is there is a rule that says we can't, as a committee, meet during session. We were trying to help, so you and Mr. Williams had an opportunity to speak. So that's why we're trying to move forward. But on those two fronts, do you think this amendment that you helped us draft today would prevent state employees from doing the types of things, forced home inspections, but also limit local governments from trying to run what we have done so far in the legislature?
Yes, I do, and it is important because many of the grants, I've tracked like 42 grants offered to states to implement various, even to promote Obamacare. Many of those grants can be offered to municipalities, divisions of government, counties, and the statute says so. So absolutely, I'm totally in favor of that.
Just this is one last point. I mean, we had a school board member removed last night here locally, and that just tells you kind of. I still can't figure out how a school board can remove somebody that was legally elected from office. But at any rate, those are the kind of things that we are exposing ourselves to that local government could run us with unless we do something today. And I really do appreciate your and Mr. Chumley meeting with us and working through this amendment that hopefully will pass and adopt today.
I'm very pleased with it, frankly. Yeah.
And
Representative Delaney.
And you have seen the other bill, 3473. What is your opinion about that bill?
I like it very, very much. And in fact, at one point in time, I was talking with Bill about merging the two. This is the one that discusses the exchanges, empowers the Attorney General. All that I absolutely love. It works.
Any other questions? Representative Smith.
Thank you very much, Mr. Chairman. Mr. Brown, thank you for being with us today. So I understand you two obviously are now advocating that this committee pass this legislation in some
As
form,
amended.
as amended.
Yes.
And are you being compensated in any way, or your remuneration?
Here, I'll be right up front.
Please,
Yes,
yeah.
here's what it is. I got $7,500. It takes
Okay.
care of my expenses. A short time away from the office. I've been here for several days, so.
Will you be registering with the Ethics Committee as a lobbyist as well?
No.
Okay. Then, my understanding is that your view of this bill, now that we've removed or proposing to remove some penalties, that would in effect mean that if somebody were in fact violating this felony that we would create, there would be nothing, there'd be no penalty for that. There would
At
no
this
be
stage, nothing. At this stage. This goes to state employees, employees of divisions of state government, of county municipalities. there could be injunctive relief, I suppose, at this stage, but as of this moment, assuming this passes, there would be no penalty such as we had. You're right.